what changed everything was the introduction of Luxatemp in 1990. This changed my life. It was first introduced to North America by a small company named Zenith, who imported this from DMG. And I couldn't even get this material in Canada. I used to actually order it in the States, send it to a mailbox stateside, drive down from Montreal, and smuggle it over the border. But learning how to use Luxatemp, which is bisacryl, which is really liquid composite resin in a gun, changed everything. It allowed me to master smile design, and I'm going to show you some of the techniques in the coming presentation. We all have used bisacryls. They come in automatic cartridges which mix automatically. They set quickly. Actually, from the time I extrude the Luxatemp out of the gun to the time it sets, it's exactly 2 minutes. I use a timer for all procedures. So from the second I extrude my Luxatemp, I set the timer. 2 minutes later, I take putty template out of the patient's mouth, and usually the Luxatemp will come out in the putty template. But the most important quality of Luxatemp that you have to learn how to work with is the fact that it can be easily added to and modified with flowable, microfill, or hybrid composite resin. Why? Because bisacryl is composite resin. So what I find most valuable, I can make it longer, I can make it shorter, I can make it fatter, I could change the color, I could reface it, and that's how I learned to do smile design. I use the patient's face as a canvas to create facial changes, to make their teeth match their lips, match their cheek, and match their personalities. I'll show you a little bit. Luxatemp is easy to finish. You just glaze it. You don't have to polish it. And the higher grade the bisacryl material, the higher the fluorescence. Because the higher grade bisacryls use better quality glass quartz particles, which make the teeth look more lifelike. The function of the temporary does many things. Of course, it protects the teeth against thermal, chemical, and mechanical influences. It does preserve the vertical and horizontal dimension of the teeth. You can also put therapeutic agents under the temporary. But the most important thing in my book, it allows me to evaluate facial aesthetics, function, and phonetics. Your prototype or your provisional restoration allows you to evaluate what the teeth like in the context of the face, the tooth position, the midline, the incisal ledge, the incisal plane, the smile line. It allows you to evaluate if your gingival levels are in the right place. You could see it in the temporary. If your gingival levels are not right and your patient is not going to accept gingival levels that are off, you either have to adjust the gingival levels by using a laser or periodontal surgery, or maybe even addition with a graft. Because the worst thing to have is a patient who's not happy after all the work is done. Your provisional lets you see the arrangement of the teeth. It lets you to evaluate the width of the arches. Are my buccal corridors full enough? It lets you see the contours of the teeth and the color of the teeth. So your provisional lets you see everything. Making a provisional today with bisacryl is very simple. What I use, I normally make a Siltec putty template, and I use Luxatemp. If you don't use Siltec putty, you could use any type of a putty. You could use a heavy body tray material and just make a putty template of your wax up or of your existing teeth. What's really important with the temporary, like I said before, it's simple to modify and to repair. You can use flowable or any composite. It doesn't matter the brand. Composite is composite. You could finish it just like you would be doing freehand bonding. You can recontour, you could use diamonds, you could use ET burrs and discs. And to finish it, it's not necessary to take it into the lab on a wheel. Just paint on LuxaGlaze, which is a glaze that's made specifically to go with Luxatemp.